What is my age biologically? So you could be 35, but you could be biologically 50.
What can someone do to accelerate the process of recovery?
They're starting from where people usually progress to, then that's obviously a cocktail for an injury. That is where most of your injuries are going to occur, and this is the only way you can prevent them.
Women should prioritize upper body strength and men should prioritize lower body mobility.
Hi, welcome back to The Wellness Blueprint, a podcast by The Wellness Co, where we break down all things health, wellness, and fitness for you, our viewers. Today I'm joined by Dr. Garima, our Chief Wellness Officer here at The Wellness Co, and a really special guest. We have Joel Pinto here with us, who is a amazing endurance sports athlete and one of the co-founders of Knox Studio right here in Delhi. Thank you so much for being with us today, Joel.
Pleasure being here, Rishabh.
Awesome. So today we're going to be talking about all things recovery. The focus of today's episode is on injuries, fitness, and how we can work better on our recovery protocols, our health practices, and our training methodologies to improve our injury recovery outcomes and mitigate our risk of injury. It's something that everyone goes through who is living an active lifestyle, working out regularly, or playing any kind of sports would know very well that injuries are just a part and parcel of the game, and whatever we can do to make our bodies stronger, fitter, and more adaptable to deal with those severe outcomes, the better it is. So, Dr. Garima and Joel, if you could tell us a little bit about why injury recovery seems to slow down with age and what anyone can do today to help themselves, let's say, age better, stronger, and feel like they're well equipped to handle their active lifestyle without suffering the risk or fearing that they'll be injured very soon.
All right. So one of the major reasons why injuries are prolonged and recovery is also extremely slow once you start aging is actually because of a couple of biological things that are occurring. So recovery is not a perception. It's very biological. The first thing that happens is your muscle mass starts reducing. Your muscle mass is reducing nearly 3 to 8% per decade after you turn 30. The next thing that happens is the collagen starts reducing, which affects your tissue elasticity. Your collagen reduces about 1% per year after you're turning 30. And this would mean that there are more crosslinks, there's more tightness, there's more stiffness, and there's less elasticity in your muscles or ligaments and tendons. Another thing that happens is that, of course, your mitochondrial function or its efficiency starts taking a toll as well. There's less NAD+, as we've talked about in multiple episodes as well. Right. And this would mean that not just that your body is in physical structures declining, but also at a metabolic level, the systems that are responsible for repairing it or regenerating different fibers are also slowing down. The last thing that also is a problem is that inflammation resolution becomes slower. So it is all four of these things that are actually creating a recipe for delaying recovery and prolonging your injuries.
Right. I think that slowdown is a very important key factor to kind of highlight and for people to be cognizant of is that, once people turn 30 or 40 or 50 even, the kind of things that you're able to do, the kind of limits to which you're able to push your body really change. And I think maybe, Joel, that's something that you can speak about as well, because a lot of the clients that we have are in those age categories and they feel that slowdown start to happen. So how can they kind of deal with that?
So firstly, I'd like to differentiate between biological and chronological age, right? So a person by their birth date, like I was born in 1990, so I am 35 right now because it's 2025, but what is my age biologically? And a lot of people don't understand what that means. What that means is an average 25-year-old looks like this, an average 30-year-old looks like this. So we have pictures of how different people look at different ages. So just because you were born in a certain year doesn't mean you will match that, right? So you could be 35, but you could be biologically 50. And the main problem is biological 50 is not a bad age in terms of health, in terms of what you can do, in terms of how much you can run, how much you can lift. But the problem is when you're biologically 70. So when you become 50 chronologically and biologically when you're 70, that becomes a problem, right? So first you have to understand where you are biologically, right? Yeah. And for that I say if you don't use it, you lose it, right? So if a person's been running, playing sports from childhood, they are at a certain better position when they get older. So the sooner you start, the better it is because you'll have those kind of adaptations.
Right.
So first thing was that. And now the second thing is, yes, as you age, that means as you age biologically, things get difficult for you. But so basically everything's going to decline. Like Dr. Garima rightly said, your muscle mass starts to decline at a certain percentage every decade, right? So the decline is like this, but you can choose if your decline is starting from here, if your decline is starting from here.
Yeah.
Right.
So this means like my decline could end where yours is starting,
Sure.
right? So the main thing is first put in the work, get in strength training, get in your zone 2, your VO2 max, all the standard basic stuff, the minimum stuff required uh, to help you, live a better life, so that your recovery requirements become lesser. So that's the first one before you look into like how can I recover stuff.
No, definitely. I think a lot of people have talked about the idea that muscles are basically the organ of longevity, right? And so setting up that strong foundation as a good baseline, like you said, people who have always, let's say, from a childhood age, grown up playing sports and played, let's say, even at a semi-professional or at a competitive level, have that stronger backing and a stronger background. But a lot of people haven't done that, right? A lot of people don't have that foundation or didn't have that kind of background experience, and they're starting fitness and health are starting to take care of themselves at a much later age. So those are the people, would you say, who are, let's say, more susceptible to injury and need to take better care of themselves?
100%. Like injury is something that nobody is safe from. Like there are some bulletproofing programs. You can do this. You can follow mobility programs, but it's an accident away, right? So the whole concept of you can't get injured is wrong. Like somebody in the peak of their fitness could just be in a phase where they're very stressed. It could be in their peak of their training, or it could be, say, I've just finished a 100-kilometer race this weekend, right? So right now, body is stressed. So if I go for a normal light jog or a run, I could get injured because my body is in a very stressed state. So injury is not guaranteed to go away. But what we can do is make sure we are recovered enough to lower the chances of injury.
Absolutely. And I think this is something that Dr. Garima and I have spoken about before as well, is that a lot of people who suddenly get into a mindset of like, like you said, there are people who have this background and know how far they can push their bodies and know what their bodies are capable of because they've always been doing it. But then there's another group of people who suddenly become interested for whatever reason, whether it's a family background thing or something that they suddenly want to do for themselves. They want to get into health and fitness. So they start off really fast. They don't really know exactly what they're doing. So the right guidance and the right expertise is also really important. And
Absolutely. And see, the way you can protect yourself from injuries for as much as possible is you need 3 pillars that are in place. Number 1, stability. Number 2, mobility. And number 3 is going to be recovery, as you rightly mentioned. The stability component basically focuses on muscle imbalances. Usually when people start because they want to lose 20 kgs or they want to gain muscles and they're starting without any personal supervision or they're starting without any understanding of their own baseline, they're starting from where people usually progress to, then that's obviously a cocktail for an injury. So usually getting a proper advice or a proper supervision wherein every muscle group is assessed first, wherein your functional tests are put into the picture, probably a couple simple tests like getting certain squats, certain push-ups, finding out if your upper body strength, your lower body strength, your jumping, your biomechanics, what is it that can actually lead to overcompensation, overuse, or an injury becomes a cornerstone in starting a fitness journey. And once you have good or ample information, you can actually prevent injuries to a very good extent. The second thing that is mobility. Obviously, people don't understand the value of mobility because to most people, they think that if I can raise my hand or if I can stretch enough, that's mobile enough. No, mobility is how far your muscle can go on its own without any external pressure or so. This is the flexibility or the length it can extend it to and then recoil back. If you're not taking care of it, either you're having overcompensations or worse, you're having any strain or some major pull in your muscle that's going to delay your progress in the long term. The third thing is recovery. Recovery is extremely important because this is where the repair takes place. This is where your body learns to regenerate. This is what governs your reflexes and your balance and coordination, and even your reaction time. And all of these things are extremely important, especially when a person starts training or even when a person starts playing with a new friend circle that they've gotten recreationally. Sure. That is where most of your injuries are going to occur. And this is the only way you can prevent them, by understanding your baseline, starting low and then progressing slowly.
Absolutely. I think that's very well said because a lot of people that, let's say, start or pick up a sport or even pick up going to the gym after the age of, let's say, 40, like you said, majorly talking about biological age, right? They maybe don't necessarily know exactly what they're doing or how best to take care of themselves after they've started a workout routine or after they've started a fitness routine, right? Which is why a lot of people report that they are starting to suffer from injuries very easily with minor movements, for example, because they haven't taken care of their mobility or they haven't taken care of their flexibility. So just a minor movement, a tweak here or there can cause a problem that you don't necessarily want to be suffering from, right? So if that's something that we wanted to kind of, touch on today is what areas or what specific, let's say, muscle groups should people be kind of concerned about training when, let's say, they maybe haven't trained so much before, or they haven't really done strength training even to that point, or they're looking to, let's say, break a certain plateau or something that they've been doing, which is very routine movement, but now they want to do something better for themselves. They want to feel a certain way. They want to lose a certain amount of weight, for example. They want to grow in their strength profile. How would you kind of guide them?
So I've seen from my experience with the clients I've trained, whoever's coming into training, as a general rule of thumb, like women should prioritize upper body strength and men should prioritize lower body mobility, because this is where most of the people lack in, like men versus different. They're built sort of differently, right? So that's a good starting point, and always get like a coach, because that will say reduce. I'm not saying you can't do it by yourself. Like a lot of people can do it by themselves. They can read. There's so much access to information. It's just that your time, basically your learning curve becomes shorter. Like you can gain a lot more in a much quicker way. And what happens is, even like a person like me, I have two coaches, one coach for my running, one coach for my strength, because when I'm strength training, like I have a tendency of doing a lot. Like even with running, I have a tendency of doing a lot. Whereas these coaches are monitoring how I'm doing and they'll deload, right? Especially with people who have high sort of discipline or motivation. These are the people who are susceptible for more injuries, because when they're not feeling good, they'll just say, I still got to do it, So their mental resilience is so much that they push a lot. That's why you need somebody looking at you from a macro level who you respect, or you pay a lot to, so that you really listen to them. I feel that's one important aspect.
Definitely. I think, guided expertise is something that we've always kind of prioritized here at the Wellness Co as well. We see a lot of clients who come in and, the access to research and information, like you said, is vast, right? Yeah. People can read all sorts of things. There's a lot of misinformation also out there. So it's really important for people to get the right information and tune out what might be noise to them, because not everything is applicable for everyone. You might read that one of the top, let's say, 45-year-old biohackers has a biological age of 20, right? Yeah. Someone like a Brian Johnson, and he's doing a crazy workout and fitness regimen, and he's like, in amazing shape or whatever. So you think, okay, I'm going to start doing that. Yeah. But you're not him. Your biology is different. You look different. You are different. So you need different expertise. You need different guidance. You need to work on different things, and you will have a certain level of, let's say, your health goals or whatever. Those are also going to be different, right? So that's where I think the personalization element really comes into it, and having someone that you get along well with, like you said, someone that you respect, or someone that really has your best interests is going to be able to guide you in the right direction.
And also a lot of people miss out on one critical aspect, is something like how we have biological age, how we have chronological age. In terms of training, there's something called a training age. How long have you been training for?
Yeah.
What is the kind of experience you have? For example, like I was doing strength training for 16 years, after which I started running. Now, because I had a solid base of muscle and say like a certain mindset to go in every day and train, my running progress was quite fast. Now, somebody who doesn't do strength training looks at me and thinks, Joel started running like this year, and in a year he's reached there. To expect him to reach there, disregarding the training age, is sometimes that causes problems, right? So you have to understand what all adaptations a person has already had. Like I did 2 years worth of mobility, and that's allowed me to, skip a few steps in, say, running. Like I wouldn't have been able to do that if I didn't do all of those things.
Yeah. I mean, just if I take my example, someone like me, for example, who majorly comes from playing a certain sport for a long time, maybe hasn't done the kind of, training to that extent that you have, my learning curve would be a lot bigger, right? It would be a lot longer. I would need to start really slow. I would need to listen to someone like you and kind of pay attention to what my body is telling me as well, because, my limits are going to look very different. And that's, I think, another reason why a lot of people usually find that they get injured during maybe even like a casual activity or even like very low strain or low stress things, because they're not moving in the correct way. And maybe they don't know exactly, where their weak links or where their pain points are. Like you said, a lot of men think that, they might be super strong and they can run really far, or like, they can lift a lot or whatever it is, because that's kind of the background that they come from. But, leg weakness, leg muscle weakness is something which is like one of the most common things that people suffer from as they kind of age. And that's something that needs to be really kind of looked at and taken care of early, because that's a lot of the people that we see as well.
And a big problem is like people casually pass this remark as injuries are part and parcel of sport, right? So what that does is, you like when you start experiencing pain or the first symptoms, I'm guilty of this, right? So I started developing this pain in my calf, and similarly, I don't know, like now that I think, I'm like, where did it come into my mind that injury and pain is a part and parcel of sport? And I kept pushing, like I could have taken just a week off and gotten better. Instead, it reached to a point where I had to take like a full 2 months off, like a month and a half off, right? So injuries and recovery demands don't add up, they compound. Right, so you have to be very careful about that also.
Yeah, I totally agree. And I think one pattern that I've seen is that people are not able to differentiate between the kinds of pain that you're experiencing after a workout or any sport. So just as a rule of thumb, if you can localize it and tell that this is where it hurts or this is where it hurts, this pain is mostly out of an injury. If it's very generic, it's symmetrical, you can't pinpoint where it is, but it's somewhere on my front of the thigh or something, then it's more about soreness. Soreness will get better when you move, it gets better with warm-up, it gets better when you keep on training, because soreness basically tells that you're doing the right thing. Of course, it calls for recovery, but you're still on the right track. However, if it's localized, it's sharp, shooting, and you can tell that this is the exact movement that is triggering this pain or it's increasing this pain, then in that case you need proactive measures taken to reduce that, because this will cause a major injury sooner or later.
Right. I think that's a very important point as well, because a lot of times an injury starts very small, right? You start to notice a slight amount of pain in a very specific motion or a movement, like Dr. Garima mentioned, right? And those are your warning signs. Those are the things that you need to be like paying attention to, that, is my body telling me something? Is it giving me a certain kind of feedback, right? Because the two types of pain that she mentioned, one is adaptation, which is your muscles are adapting to the soreness. They're getting stronger. And so you need to recover them, of course, but you need to keep training, and you need to kind of, listen to your body, reach a new, like, let's say, plateau where you feel strong enough to, let's say, do a certain type of exercise or push yourself to a certain extent. Then you load it a little bit more from there, right? But if it's, like she said, if it's shooting pain, or if it's something which is, not seeming normal to you, you got to get it checked out early. You got to go to a wellness center. You have to go see a doctor and make sure that you're taking care of yourself, because that is, if left ignored, going to 100% lead to injury, right? So,
and there's a third type also. It's not really a pain. You'll start finding a certain part of your body tighter than the rest, like normally, right? Yes. So that's the early indicator. Something is being tight. That means your muscle is being contracted. So it's trying to protect itself, right? So it's not where you feel the tightness, something above or below or around it. But in those cases also, you should like deload or, reduce your speeds, reduce your intensities, or take a few days off and get back into it and see if it's still there. If it's still there, you need to go and get it checked.
Right.
Especially because in such cases, it can be a biomechanical issue also. So you need to perform the same exercises that you've been doing in front of a trained person who can guide you in terms of any overcompensation, any overuse of a particular muscle group, or an overactivation of that muscle group that's basically trying to avoid any injury per se. So it's not just pain. As Joel mentioned, it can be tightness, or it can also be instability that people feel during their movements. That should be a cue that this is not right and I should get it checked, because these things you're not supposed to push through.
Of course. I mean, as far as what the kind of research tells us, almost 72% of all chronic pain cases and injuries start as ignored mobility or movement issues, right? So these are the kinds of setbacks that someone really wants to kind of, avoid as much as possible, because another aspect of what we had discussed is that when you have a level of, let's say, biological aging, which is occurring beyond the scope of your chronological age as well, right? Someone who might be at the age of 40, but their biological age might be like a 48 or a 50, right? They need even more attention, and their setbacks are going to be even longer, to the point where, now you're looking at months and months and even years of time that you could lose, that you could be investing into your health and wellness, where you're just taking care of pain or issues with chronic pain that can develop into really bad kind of, let's say, cycles that affect you into much later in life as well. And these are the things that I think people are really working on trying to avoid now.
Yeah. And and the later you try to fix something, the harder it is to fix.
Absolutely, absolutely. I mean, another thing that we really wanted to kind of mention today is what can someone do to accelerate the process of recovery, right? This is something which, is a concern that a lot of people have as well, is that, okay, I am training and I am working out and I'm playing sports, but it seems like I'm slowing down. It seems like, between every session now, I need to take 2 to 3 to 4 days of rest or something like that, because maybe they're not using the correct interventions and they don't have the right guidance. So in your minds, what would be the best way for someone to, let's say, start thinking about their recovery?
I think there are tiers to it. And from my experience from, training people and training with really good athletes, the first tier would be sleep,
Yeah.
right? If you're not sleeping well, there's no use of a red light therapy or cryotherapy or any kind of therapy, right? Or even training, because it's just going to increase your load of your stress on your body, right? And you're going to push it, and it's going to, be worse for your body than good for your body, all the good stuff. So with sleep hygiene, like when I say this, it follows for 80% of the people. Some people require less sleep, some people require more sleep. If you have a tracker, you can track and see what is the kind of restorative sleep that you're getting. Like for me, my restorative sleep in terms of percentage is low. So that's why I need a higher number of hours. But somebody else might get away with, say, 5 hours of sleep, right? So you need to figure that out in how many hours you feel well rested. First is that. Second is you got to wake up and sleep at the same time. So that puts your body into a certain clock, right? Now the third is try to sync it with the sun. So it's in the circadian rhythm, right? So that really helps. Like if you cover these three things, first step is time. Second step is wake up and sleep at the same time. And the body doesn't understand weekends, right?
Yeah.
So weekday, weekend doesn't matter. You wake up on the same time. If you want to sleep extra, take a nap, but keep that pattern synced. And the third is sync it with the sun. So this, I think, is the main point. And the second point is, stress management. And by stress management, I don't mean, I mean, the body doesn't understand the difference between physical stress, emotional stress, mental stress. So if you had a bad day at work, but you slept 12 hours, you're still stressed. If you've taken a flight, you're still stressed, right? So you have to manage those stresses. So if you had a bad day, you're not going to go to the gym and take it out on the punching bag, right? In fact, that day you want to do something like a mobility. So if you have these two things covered, everything else becomes easier. But these are the things that we go to at the end. We want to first find out which workout works for me, what supplement works for me, which fancy therapy works for me. But unless these two things, which is the foundation of everything, there's no point in doing this. And I think the step after this for recovery is food, right? So you need to first figure out how much do you want to eat, and that will totally depend upon your lifestyle, right? Uh, like I see a common problem, especially in these Indian families, is they're still eating traditionally. Like I remember, like now my food at the house is quite different. But I remember initially when I was a child, we were still eating the same food that was sort of eaten in the village back at my parents' hometown. But the thing is, they are farmers. They were farming all day, so they could get away with eating heaps of rice 3 times or 4 times a day, right?
Because they're
In
very
fact,
active.
Yeah.
They're
in
out
fact,
and about,
they
yeah.
needed that. They
Yes.
needed that fuel, right? So a lot of people who come eat traditional foods now are sitting on desk working from home. It's not going to work for you. So you have to
Correct.
eat as per your lifestyle. Like earlier, like I would have about 24 to 2700 calories, but now on my running days, I'm having almost 4000 calories if I have a long run.
Right.
So you have to adjust for what you want to eat, and no food is bad. Like so many times they tell you you shouldn't have processed foods, but for a person like me who's running, I need processed food so I can absorb it fast, right? For somebody else, they don't want anything that gets absorbed fast because they're not going to consume it in that much time. So you have to understand, and you have to eat. Basically, you need to eat with purpose. There should be an intention behind why you're eating something.
Right.
Like I joke about this, and some of my clients like, why can't I eat this? I'm like, why do you want to eat this? Like, because I feel like, I'm like, if you feel like putting diesel in a petrol car, it's not going to work, right?
Yeah.
So it's you have to like eat on purpose and what you want to get out of it at least 80% of the times, and the rest 20% of the times leave it out for when you're out with your family on a vacation. I'm not saying it's going to benefit in that, it's going to be a little detrimental, but like a big pillar of longevity is community and being happy and having a purpose. So that also has to be solved, because
Absolutely.
if you're biological age is 18 and you're 60 years old, but you're all alone in a room. It's not fun.
I think that's very well said, because I was really going to touch base on the kind of nutrition point as well. Is if you don't fuel your body correctly, right? If you're not doing the right things, even something as simple as hydration, right? A lot of people, which is a very kind of chronic problem in Indian society especially, do not drink enough water, right? They're not even drinking enough water to sustain their very sedentary lifestyle. So imagine what's going to happen when they start living an active lifestyle, right? The body doesn't have enough fuel to kind of recover the way it needs to. And these are the reasons why you will start to have those kind of micro tears and those micro issues in your body start to accumulate if you start to push yourself. Because if you're not recovering in terms of sleep, in terms of nutrition properly, nothing else is going to work for you. There are no shortcuts in this. Yeah. Absolutely. And that's something that we try to inform our clients as well. And I think it's a kind of a hard road to take with a lot of people who are very used to, like you said, living in a very traditional mindset. But I think that shift is slowly starting to happen, because once people see the real results, or they see that, a friend or a family member or someone who goes through a guided process of a fitness program or a holistic health program or a health protocol or something like that, they are definitely getting those outcomes in a better way.
As fitness professionals, we need to change the way we put things. Like how we say it's a program. It's not a program. It's a life. Like Dr. Garima would put somebody on a program for 3 months, and once you stop it, it's gonna go. If you don't use it, you lose it, right? Yeah. So basically, maybe you were injured, so you might have to do it, say, 10 times in a month. But after you're fixed, you still might have to do 5 times, and after some time, 2 times. But you want to still continue it 1 time. It depends, but it becomes a lifestyle. Same with food. You can't lose 10 kilos on a certain diet and then hop back into what you were doing. You'll get back to where you were. Like a normal question that comes to me is like, 20 years ago I was fitting into jeans. Can I fit in those jeans again? I'm like, definitely. It's like, what should I do? I'm like, go do what you were doing 20 years ago. That's it, right? Yeah. Like until unless you have a illness or something that we can figure out through other ways, but that's the way. You got to do what you were doing at a certain age to replicate that.
Of course. I think that's a very kind of key thing to highlight for people as well, is that, the routines that you're currently doing, if you don't change them from a lifestyle perspective, right? If you don't have that lifestyle modification, lifestyle adaptation, as we like to call it as well, you're not going to see anything more than, let's say, a temporary result, which is just going to be like a flash in the pan. You'll feel good for maybe a few months or whatever it is, but then you'll slowly start to kind of go back into those habits. It has to be sustainable. Yeah. It has to be long-term, and it has to be something that the person is committed to just as much as their trainer or the person who's helping them, right? So I think that is another key thing that we try to like build in with the mental side of things, is that motivation that, you have to take it seriously. If you're having a setback, if you're suffering from an injury, if you want to do something good for your health, and you have to focus on the pillars that we have mentioned today here with the mobility, pliability, flexibility, etc. So I think those are the key kind of takeaways that I would say for anyone would be important.
One thing that I'd like to add here is that recovery and injury prevention sort of goes hand in hand. So of course, you have to get your foundations right. You have to work on sleep, stress, and nutrition. In addition to that, when you're training, you need to focus on data. Anything that you can assess in terms of your functional performance or in terms of numeric values for your muscle strength. And the second thing is very deliberate progression. So usually what we try to do here is that, let's say that we have identified a barrier in stress management or a barrier in sleep management. The therapies that are suggested or recommended are revolving around improving those aspects for your foundation itself. Mm-hmm. Let's say that a person is deficient in certain micronutrients, in essential minerals and vitamins. Either nutrition programs or even IV drip therapy go a very long way for such an individual to ensure that not only are they recovering properly, but their cells are being given enough ammo to repair themselves in a timely manner. And in addition to this, of course, there are parameters such as making sure that we're taking care of the soreness, we're taking care of any muscular imbalances. So we often work with a combination of whole body cryotherapy, far infrared saunas, or even EMS training to certain extents to identify and target those specific muscle groups that you'd like to train better or I would say strengthen more. For example, the stabilizers, as I already mentioned, are extremely important when you want to work towards injury prevention also for a person, because stabilizers are going to ensure that you're loading the joint properly, that no other muscle is overcompensating, that there is no tightness, there is no overuse, and at the end of the day that there's no injury. So there are in fact multiple muscles that are often overlooked when a person is working out, and I think, Joel, you must be able to tell more about that based on your experience. Because mostly when I deal with injuries here, I've realized that sometimes people are absolutely unaware about the biomechanics or the muscle engagement patterns that they're employing during simple movements like a squat as well.
Yeah, so that's, I think, to do with like we are not introduced to exercise at an early age, and we
Yeah.
start doing it at a much later age. And I've seen, like a young child can get into a perfect squat, and it usually goes away when the child is introduced to school. When he starts sitting on a chair, basically,
Yeah.
right? So most of these issues are coming from people who are sedentary and sitting a long time on the computer. Like, I'm on the computer all day here, I'm on my phone this way. My chest muscles start to get tight, my upper back muscle starts to get weak.
Yeah.
So usually when somebody comes in to Knox to train, firstly we try and fix out the lifestyle issues, because if I start say strength training with them, they to be able to put on some kind of muscle is going to take say 12 weeks, sometimes 3 months, 4 months, 6 months, depending upon how well they're adapting or where they're starting from. These mobility changes basically improve your quality of life. So within a few weeks, sometimes within a few days, you start to feel good outside the gym. And that's when you start realizing how important mobility is.
Yeah.
So now with sitting like your shoulders on the computer and the phone, even your hip flexor muscle starts to get tight. And usually your glute muscles are weak, and because your glute muscle is weak, maybe you feel pain in your knee, and you keep massaging your knee. So that's why you need an expert to figure out what's wrong with you. They will assess you. And a lot of people see data, but there are two kinds of people I've seen data with. There are people that data empowers them, there are people who data paralyzes them. So if you're of the second kind, just go to an expert, because a lot of times you see blood tests, that is off doesn't mean it's off. Something that is right also doesn't mean it's right. You have to find correlations, right? So you might go and start doing tests, you might not figure it out, and all of those things, like with exercise, nutrition, as well as sleep tracking, all of this. So if it paralyzes you, just go to an expert.
I agree.
Absolutely. I think a lot of what we talked about today, the benefits are like numerous to your long-term health, and something which everyone should be cognizant of, because taking care of your body in such a way actually doesn't even just help you prevent injuries. It makes you functionally stronger, makes you feel better every day when you wake up. You don't have those aches and pains constantly bothering you. You know how to deal with them properly. You're training those weak spots effectively. You're making sure that your flexibility is not declining, which starts to decline as early as 25, which is another huge area of concern for a lot of people. So these are the things that can really help someone improve their kind of, quality of life, like you said, for a longer term. And I think that's the main takeaway that we'd like to probably leave our viewers with here today, is that, the experts are here for any kind of, queries and questions that you have. So it's really kind of up to everyone to find them and to make sure that they have a very open and honest dialogue with them about what things they might be struggling with, and put a lifestyle kind of, adaptation protocol in place that really works for them, not against them. Yeah. Thank you guys so much for being here, and we'll see you in the next episode of the Wellness Blueprint. Thank you.